Hello, friends. Welcome to the Ancient Health Podcast. I'm your host, Dr. Chris Motley, and we're going to talk about seasonal depression. Do you have seasonal depression, also known as the winter blues? Do you feel that when the summer months are leaving and you're alive and happy, and when you get the report on the news from the weatherman, weatherwoman, that there is a chance of long, cold winds coming in, shorter days, darker days, and do you find that you get a little sad? Maybe you get depressed. Maybe you lose interest. Maybe you lose passion. Maybe you don't have a zest for life. Well, it is a real thing. And there was a doctor named Norman Rosenthal, who's a psychiatrist, who coined the term back in 1984-85. And it's also known as the winter blues. And so he was noticing that within his patients that they would have some form of depression or sadness right when the weather changed, right when it got into the winter months. So it's a real thing. There's lots of reports about how individuals suffer from seasonal affective disorder or SAD. In fact, in Alaska, they say that individuals have to use light therapy on their eyes because if they can get more sunlight or more light, it actually helps certain receptors in their brain to actually activate to keep them happy. But the constant darkness, the constant long days of darkness has been shown to cause higher amounts of depression, higher amounts of alcoholism. Unfortunately, some individuals, there's higher amounts of suicide just from something as we think is just a seasonal issue, but it's not. It's very, very serious. So for you out there that are suffering from this, please pay attention because I want to give you some, a little bit of history. I also want to talk about what you can do according to Chinese medicine, especially acupuncture, to help your body because the winter blues, the winter months in Chinese medicine are connected to what we call the water element. And the water element is associated and connected to the kidneys and the bladder because they are the organs that basically manage the operation of fluid balance within your body. Does that make sense? Kidneys help you with urinating. Bladder holds your urination, so it balances the amount of fluid that not only goes out into your urine, but the kidneys balance the amount of fluid that goes into your bloodstream. Yes, water into your blood arteries. And then you have higher or lower blood pressure. So it's a real thing. And when we have the kidney and bladder, we have to look back in our history, in our health history, if our parents, grandparents, or we ourselves had issues with kidney bladder problems like kidney stones, bladder stones, kidney infections, UTIs, chronic UTIs. If that is you, and you notice that now you have seasonal depression, there could be a huge link involved. So I know there's many angles to come at seasonal depression. I know that there's different medications, there's different supplements, there's different herbs. I'm coming to it from a Chinese medicine perspective, and I know that there's many Chinese medicine practitioners out there that really have great info, so please send that stuff to me, guys. You know that I love information. Just send it to me. I love to keep learning. So if I'm missing anything, you let me know. But when we talk about the winter months, you talk about the kidneys, one of the things we want to make sure that we also address is that the kidneys and the bladder are associated with fear. Also, the fear of being stuck, abandoned, left behind, or feel like you're out of place. Okay, so follow me. You're out of place. You don't know what your goal is. You do not know where you're going in life. That is a huge emotional setting program associated with the kidney and bladder. So keep that in mind. So if you're sitting there going, yes, that is exactly what happens when the winter months come. I start to lose focus. I lose attention. I lose passion. I don't even know what I'm going to do with my life. Trust me, this is associated with your kidney and your bladder. So don't lose hope. Now, one of the ways that I really got interested in talking about the seasonal depression is I have a little story. I'm having a little sip of my coffee. If you guys are watching, I'm thankful for my great coffee shop across the street from my office. I just love their coffee. It's beautiful and organic. But I had a patient, dear gentleman, and his wife told me that he does great during the summer. He's so motivated, gets so many things done. But she notices that he gets sadder right when the fall or the late fall season starts to come upon us, when he has to stay indoors. So she noticed that whenever he would stop mowing the lawn, that was his thing. He'd mow the lawn. He loved to mow the grass. He loved to be outside. He felt the warmth. He loved doing yard work. He loved being outside. And whenever the day started to get a little darker, like literally when the day started getting darker around 6:36, and then started moving up into the 5 o'clock range, he would start to get depressed. And she noticed that. She goes, I can't motivate him to do extra things that he wants to do, that he's been talking about doing. He seems like he gets pretty sad and he gets overwhelmed easier. He loses a lot of focus and a lot of attention. And I was thinking, well, it definitely has to do with his seasonal issue, that the season changing can affect you. Now, in Chinese medicine, in one of the books that I have, it says that you cannot separate the physical body and the seasons. The seasons will change your body, and you guys know that. Whether it's cold, hot, wet, warm, dry, you know that your body perceives all this information, and you pick up on it, and you know that your body's making hormone changes and shifts and trying to make all the adjustments according to what you're going into in the day. And you know that. And our bodies are so smart. You know that you could get into an environment that's toxic, like around toxic people, and your body shifts. Same with the environment. That's why some people love the Northwest, the rain, a little bit of the gloom. Some people love like the Southwest, where it's like dry and arid and sunny most of the time, cold nights, really hot mornings and days. South, Northeast, they all have differences. Why? Because the seasons and the temperature and climate are associated with your physiology, and your body loves them for some apparent reason. This all can do with the type of element in Chinese medicine that your body is. So let's not get away from the kidney and bladder, but this dear man, he said that he loved going down toward the ocean. There's a place down in Florida that me and him love, like we talk about it. When I go down there, I see some of my friends and I love walking on the beach. I don't care if it's, a little chilly, a little cloudy at sometimes, but usually the sun comes out, and I love to ride a bike down by the beach, by the ocean, and just go maybe for a 3-mile ride. And I'm telling you, it is like somebody shot my arm, put an injection of happiness right into my life. Does it happen to you? And if so, this happened to this gentleman. He loved going on bike rides. And what I thought was the best was that he would tell me, he goes, man, I come back here and I am just more focused. And I wish I could go down there every 3 to 4 weeks. Give me a little amp up. And I'm with him. I decided to try to go down there as much as possible myself. And I actually had another friend that does functional medicine, Mr. Evan Brand. He's an awesome functional practitioner. You guys need to check him out on Instagram. He does great information. And he was one of the guys also that encouraged me to look into going down to Florida more. He did, because he found that the depression or the gloom or the days were making his mood go low. So back to the gentleman. Sorry, I'm diverting. But there's a couple other things. So I noticed when I worked on him that his kidneys would always show up. So if you can imagine, I have a patient laying face down. If you're in the office, you're laying face down or even face up, but face down, they call them, we have treatment points on the back. And on the back, if you guys can see here on the Chinese medicine doll, right here, around the T12 and L1 in this area, that area is associated with your kidneys. So if you out there have chronic back pain around the thoracic 12 L1, right at that thoracolumbar junction, right here, or that area right at your flanks, when you put your hands and your thumbs up and behind your back when you're standing up and you're stretching back and you're going, oh, you guys can imagine that. You're touching your own back and you're putting your thumbs right in those kidney spots, those little fossas, they call them, kidney fossas. You are essentially massaging your kidneys because they're weak. or they're imbalanced. He had this. Every time I touched those areas, his QLs, the quadratus lumborum, like check this out, guys, right here. You hear that Southern in me? Check this out, guys. Right here. These areas on the QL, they are the muscles that are related to the kidneys and also the hip flexors. Do your can't even say it. Do your hip flexors get tight? Do your low back QL muscles, those little stabilizer muscles, get sore a lot? Randomly. Now that is a kidney issue or a bladder issue. So he had this. He had hip flexor tightness, low back pain. He also chronically had calf muscle tightness and plantar fasciitis. Follow me here. The kidney meridian flows from the ball of the foot up through the inside of the arch, up the inside of the leg, if you're listening, inside of the leg, along the shin bone, the back of the shin bone, up through the knee, up through the groin and pubic bone area, and up through the middle of the body to the collarbone. That's where the kidney meridian runs, all through that area. Right through your hip flexors, right through the kidney points. Also, his calves and heels, which is the bladder meridian. The bladder meridian runs over the top of the head, down the back, all the way down through over the glutes and through the hamstrings, through the calf muscles, your gastrocs, and down through the heels. He had to stop running long distances because his calves kept cramping. Another thing, I noticed that whenever he would lift his shirt to show me where his back hurt, and I was checking, he had small moles, small freckles, all along the bladder meridian. In fact, on his hamstrings and calves, he had moles, skin tags, and freckles all down, if you can watch, this area where these bladder meridians ran. Does that make sense to you? Okay, so he had all these signals. Hamstring, calf, moles, skin tags, freckles, which are all signs of possible viral infections that are in the skin that are being pushed out and crowded around by your cells to push them out of the skin. That's what a freckle, a mole, a skin tag is, in my opinion. The plantar fascia, heel pain, any type of low heel arch pain is often associated with bladder infections that are hiding. I don't care if you get a UTI and it says it's negative. You need to go into a good lab such as Microgen DX. If you really want to go deep into your UTI, kidney and bladder infections and kidney stones, please, if you're listening to this, we'll put the link in the show notes. Microgen DX. It is a lab out of, I think, Lubbock, Texas, I believe. But it goes and looks for over 50,000 different bacterial infections. Even if you don't find them, at least you're looking for that many. You get the Euro key for Euro, like urine, key, Euro key test. If you're out there and you keep getting kidney pain, low back pain, the calf pain, the heel pain, and you're getting all these things I just mentioned, and you go get a urinalysis test and they say, no, you don't have UTI. There's no E. coli. E. coli is just one of the many bacteria that could be possibly in your kidneys, in your bladder. There could be strep, there could be staph, there could be some forms of Campylobacter or Clostridium. There are many bacteria that can be in there. Honestly, I do not know why in the Western medical world that's all they search for is mostly E. coli. That's the only thing they really look for. There's over 50,000 other different types of bacteria that can go into your body, into your kidneys. We need to search for all those. So if you guys have a doubt, go look for that. We'll put the link there. This gentleman, remember, he had the heel pain, couldn't run very well. And one other thing, many other things. Underneath his eyes, right here, if you can see, if you guys are watching, but if not, those little areas where we call the bags under the eyes. You ever had that? In the morning, you're like, oh, my word, I got bags on my eyes. I'm going to put ice on there. Going to try to get the swelling to go down. The lines right under the eyes, the swelling under the eyes, usually are associated with kidney stress and kidney fatigue. So right there, bags under the eyes, dark circles around the eyes, the calf pain, heel pain, all these things led me to look into the kidneys. And then his wife tells me that he has seasonal depression. So I started to investigate. And here on my notes, it's really interesting. For him, it's basically in the Chinese medicine world, they always associate the winter months, the winter blues, with the kidney and the kidney to the water. So as I investigated further, I found from frequency and bioscanning with pulse points and with tongue analysis, Chinese medicine, I found that he possibly could have had heavy strep with some E. coli. And there was also a small amount of staph. So then we started to work on primarily the strep, and we started cleaning that out. The fatigue in his low back and his hip flexors, they went away. His calf pain went away. He was able to run again. And his wife noticed that as he started to clean out his kidneys with the herbs, now the herbs I'm going to mention just a second, but with the cleaning out of the herbs, she noticed that he was getting happier. He was cleaning out his kidneys and his bladder. That meant, guys, that the chi, the electricity, was going up through his leg, the inside of the leg, into his knees, into his hip flexors. And the important thing about the kidney chi also runs right up the chest into the heart, and it feeds the heart energy. So not only was he able to run and do his exercise during the winter months, but the kidneys are vital for giving energy to the heart. So weak kidneys, weak bladder will mean weak heart function, truly, in Chinese medicine. Literally, the energy of that kidney is going up into the heart, and if your kidneys are strong, there are hormones your kidneys release, erythropoietin, that signals to your bones to create red blood cells. And if you have a sufficient red blood cells, your heart feels happy because it has enough red blood cells to put oxygen into. Does it make sense? You have plenty of red blood cell reserves if your kidneys are healthy. But what if they're sick? You get low level possible anemia, low oxygen absorption, which means your heart is unhealthy and unhappy and imbalanced, and your heart has to work harder to get more oxygen to all your tissues. It has to work harder. Now, what happens to your heart and your mentality and your psychology when you have to keep working hard? You get tired easy. You want to give up. You lose focus, just like the winter blues. Your heart is working overtime and extra because your kidneys and bladder are possibly tired. And the kidneys, no fault of their own, can't put enough energy into the bones to create the red blood cells to support the heart. And it can't shove enough energy up into the heart. And the heart's going, yo, I am tired. And I have to work extra hard, even at night when I'm supposed to be sleeping, to keep pushing oxygen to my tissues. Because my kidneys, again, no fault of their own, are absorbing more energy because there's infections lying in them. Also in the bladder, possibly. So the heart is kind of screaming, saying, I'm tired. So then during the winter months, you can notice that maybe the heart rate can be a little off. Blood oxygen levels can be a little bit lower. Blood pressure can be up and down. And one of the things that this patient was noticing during his depression was that his heart rate would shoot up and down, and he would have heart fibrillations. He would have little tachycardia sessions. When we started to clean the kidneys with the herbs, such as I just primarily used uva ursi and reishi mushroom. Uva is spelled like UVA, University of Virginia. Ursi, URSI. Uva ursi herb is beautiful berry that cleans out the kidneys and bladder. Reishi mushroom, shaped like a kidney, loves to clean out the kidneys. So we used it to clean out the kidneys. The heart tachycardia went away. Blood pressure, heart rate stabilized because the heart was getting enough red blood cells, is getting enough energy from the kidneys. All interconnected, guys. They're not disconnected. And I love information like this. So if you guys are Chinese medicine practitioners and have even extra information or anything, please send it to me. I love this kind of talk. So one thing as well was that he noticed that he would always urinate at night. He was getting up 3 times at night to urinate. Because the bladder and kidney are weak, the staph, the E. coli, strep were in there, and his body's trying to purge them out, trying to clean it out. It's like, it's no good for me. It's just making me waste energy, so I'm going to try to pee it out. We started to do that. He went down to 1 time at night, which was great. Energy got up. Heart started to feel better. He started to have more focus during the winter months. He noticed that he was more driven, so just from uva ursi and reishi, which are great kidney formulas. Another thing had happened, though. I'm not saying it causes any type of prostate issues, but if you can imagine that any type of urine that's stagnant within the bladder, if it's stagnant like a stagnant pond, can you guys imagine that? You have water in a pond that doesn't get oxygen. So we already have kidney issues not getting red blood cells to the heart to get oxygenated. Does that make sense? Red blood cells go to the heart to get oxygenated from the lungs. So if there's not enough oxygen in the tissue, if you have cold hands, cold feet, cold limbs, that's a big signal. That oxygen helps the water in the pond, right, to stay fresh, not to get stagnant. But what happens when there's not enough oxygen in the body? Not enough hydrogen. A lot of leading experts say that things go stagnant. You'll start to notice that the urine will actually accumulate more fungus, more yeast, more mold, sometimes parasites, and bacteria. So remember, we found E. coli before. He started having prostate issues that he said were probably lurking from the past. So he went and got a checkup. And this is after we started doing the kidney cleansing. And he noticed that his prostate, his PSAs were going up. I believe that stagnant urine can go through, especially the urethra, going down to get excreted. And those infections can make their way into the tissues around the urethra, the tube that excretes the urine into the toilet bowl. And what is it for the man? The prostate. So anytime I've ever found a very big bladder infection in men, I've always found that they had prostate issues. In women, I've always found that they had ovary issues. I'm not saying it caused it. I'm just saying there has to be a huge correlation of the infections moving into those tissues that are around the bladder. So we had this. So we started to look into it, and I said, you need to go get some deeper investigation, deeper testing. Now, they said he did not have E. coli. All right. So I said, well, we need to do a little bit more cleansing with the uva ursi. We did some uva ursi. We kept going on for a couple months. He was getting better, not having too much urinalysis. His prostate numbers were a little still off. And I believe he did a round of ivermectin for some parasitic issues. And I think they wanted to use that in the case of different COVID problems, and wanted for prevention in their practice. I'm not recommending it to everybody. I'm just saying that's what they love. That's what they wanted to do. And he started using that, and he started using a small anti-parasitic remedy that he showed me. And after he started knocking things loose with that, while he was taking the uva ursi and reishi, it was amazing. His kidneys got super strong. You could tell. It helped. Hip flexors got really, really strong after that. But he was urinating a lot more warm urine. This is a lot to take in. So he's urinating more hot urine. And his numbers for his prostate were getting better. Now, I'm not saying this cures it. I'm just saying his numbers were getting better. We're like, huh. So they went and did another urinalysis, and they found high amounts of E. coli when they did a more intensive test for urinalysis. They didn't before. But when you study E. coli, and this is on CDC, this is on the reports, like on National Institute of Health, E. coli and strep and staph have proteins that stick to the walls of your bladder so strongly and in the urethra that they can keep from getting into the urine and getting into the cup to get it now analyzed. In my opinion, my thought was that his extra work, his own ancient ways of healing his prostate or healing his bladder, was knocking loose this E. coli that was hiding. because in my bioscanning, my frequency medicine scanning, I found it. I can't say, I said, I suspect it. I suspect you have this. We need it tested. And he went on a regimen and they gave him some antibiotics. So he used that. And sure enough, it helped his numbers out tremendously. I know I went through that whole story, but I wanted to give you guys an idea of the interrelationships of how your kidneys and your bladder affect your heart, affect your strength, affect your mood. But think about it, guys. The heart's tired. It's working hard to oxygenate. The kidneys feel tired. And what do they do in Chinese medicine? They hold your qi. They are the battery packs. Right there, you're totally chronically fatigued. The bladder is fatigued and it's trying to get rid of waste, but it can't. And then you have a hormonal gland like the prostate in men, the ovaries in women that could be affected. And they are trying to help you produce a lot of testosterone and sex hormones. Who would not be depressed? We can't forget that the body is interrelated. We can't forget that they are all connected. And you and I out there, you guys, we got to look at it and say, hey, each organ is connected to each other to help each other. And yes, you do have the kidney doctor and the heart doctor, the lung doctor. And I believe in that. It's great. But there are such huge interrelationships that we cannot forget those. Thankfully, this patient has been doing good herbals, such as the one we mentioned, has been taking multi-minerals, a good multivitamin, and I've been doing plenty of my own work on him with acupuncture. And he also has a good separate acupuncturist that really goes in and helps with the kidney and bladder along with what I do. And one of the things I would recommend to you, if you have seasonal depression, I would look into getting a UroKey and checking if you have hidden kidney and bladder infections. I know it's a lot to ask, but if you can't get an answer and you know that your dopamine levels and your serotonin levels, I believe in all those things. I know they are affecting you, serotonin and dopamine, and there's stress, but you need to check if there's any kidney or bladder infections. It's very, very important, guys. I mean it. This could lead to long-term heart issues if you're not careful. This will lead to issues that are associated with the kidneys, like blood sugar, diabetes type 2. And if you research it, there is a high correlation, in my opinion, of kidney infection, kidney disease, bladder infections with type 2 diabetes. I'm not saying it caused it, but I think that it is a correlation. When this seasonal affective disorder, when the winter blues come up, it's because you don't have enough energy in the kidneys and bladder to support the heart and support the hormonal system. This gentleman is doing so much better. Doesn't get sad hardly at all anymore. If he does, he may go down to the ocean and get that sunshine. What do I recommend? Of course, I recommend a ton of sunshine. Go down to the ocean, or if you can get down to the sun, get to the sun as much as you can. You know me. Get on a bike and ride by the ocean. Do what you got to do to be outside and get in that sun. Use the Uva Ursi or the Reishi. Use sauna. Use infrared sauna to get warm and get that light on your skin if you have one. Look into infrared sauna. Start cleaning the kidneys out. Drink plenty of water. 6 to 8 glasses, if possible, a day. I'm serious. It will help your kidneys. Stay high on your electrolytes. Use a good multi-mineral. I love Beam Minerals, BEAM. Beam Minerals is what I love. They have an electrolyte and a multi-mineral in fulvic and humic minerals, and they detox your cells. They support your cells. They strengthen your cells. I just put it in a little thing of water in the morning, and I just chug it. It's amazing. Look at Beam Minerals. Check them out. Beam Minerals. I also love a good multivitamin. Now, there's many out there. I do like Thorne Research, THORNE, Thorne Research multivitamin, like their basic 2-a-day. Zymogen, XYMOGEN, Zymogen, they have a really good multivitamin. Those two, and there's many others. But you want to get a good multivitamin. You want to support the kidneys. You want to get acupuncture if possible. And if you're afraid of needles, find somebody that does acupressure. Find a kinesiologist, applied kinesiologist in your area, and get your kidneys and bladder checked. Those are my options. Acupuncture for kidney and bladder, applied kinesiologist, or somebody who does some form of acupressure, a holistic practitioner. Go to Microgen DX, D as in dog, X as in X-ray, and get the Euro key if you need it. Last of all, this patient of mine also I would say that he was aware that in his family line that there was fears. And there can be fear in many forms, but I want you just to analyze this in your own life. I'm not trying to get too emotional about it. Fears as fear of, yes, being afraid when you're a kid. Something made you afraid. Was it parents or friends or bullies? Somebody made you afraid. Or something made you paralyzed with dread and fear and complete terror. A trauma that created terror in your life. And you remember from that point on that you had fears, jitteriness, anxious, fright. That's the kidney and bladder. Also, fear in this form. The fear that I'm not good enough. The fear that I am not accepted by everybody else. I feel like a fish out of water. I feel like they call it the abandonment conflict, a refugee conflict. I don't belong here. I don't know where I belong. I don't know where I'm going to go. I don't know what my future holds. I don't know what my direction is. I feel like I'm lost. These are serious traumas and emotions you need to analyze. And I would recommend, people say, well, yes, well, how do I do it? And I was like, I love talk therapy. But one of the things I really love to do is putting it into your own hands, and people love tapping. I'm serious. Tapping the acupuncture beginning and ending points, EFT, emotional freedom technique. Doing these at home has shown tremendous help and benefit for PTSD, anxiety, seasonal depression, you name it. This has helped so much. So if you want to look into it doing yourself to help with emotional clearing, please look into emotional freedom technique, EFT. Also, if you don't want to do it yourself, look into a practitioner that does NET, neuro-emotional technique. Write that down, neuro-emotional technique. I believe their website is NET, Mind and Body, or Mind Body. Mind and Body. Carrie Jacobson's a great NET practitioner in Chicago. If you have any doubt, Dr. Carrie, I think it's Cari, Carrie Jacobson in Chicago, has great NET experience. Look her up on Instagram and look up their website and find a practitioner in there that does this and go through your traumas. It is a way to use acupuncture points, and spinal alignment to help your brain recognize your emotions in your organs and process them out in your frontal lobe. Truly, guys, it works. It worked on me. But if you don't want to, go to do EFT tapping. You could have fears, dread, paralysis, fright, fear moving forward, or fear of being stuck. If this is you and all these things align, please know that you can get help and healing with your seasonal depression. Trust me, I've seen it. I see patients get better during the season because they heal up their kidneys and their bladder. Well, that was a lot. I hope you guys enjoyed this. And if you guys like this kind of information, you like this talk, please let me know. Send me a comment. Give me a like. And if you like this type of podcast, subscribe. And if you know somebody that has seasonal depression, send this over to them. I'm really here to help. Thank you so much for listening today. And remember, on the solo podcast, what I do is I have a membership, and the link is in the caption. It's also on my bio on Instagram. But my membership, we do a weekly Q&A, and it's usually on Wednesday nights. And I take the information from the solo podcast and I jump on the Q&A and we go deeper into them. We talk about them. We go over people's cases and just talk about it and just have a community. So if you're interested in going deeper with seasonal depression, please join up on the membership. I would love to see you, get to see me face to face every month. I'd love to meet you. And guys, remember, have a blessed day. Thank you for listening. From all of us here at the Ancient Health Podcast, enjoy the day. Love y'all. Take it easy.